Welcome back, dear friends. Welcome to my channel, and please subscribe to my channel. And today we are going to discuss about the fifth part of the Spotters, that is head and neck osteology Spotters. So, what are the Spotters usually they keep from osteology, from bones? Let us discuss about it. So, in this part, I have divided into different parts for time being, and you can easily remember that. I will just show all the Spotters. You try to see that carefully and try to remember that. And what you have to do is please find out the answers for the questions which I am going to put in front of you. Thank you. Let us see that. So this is the first picture which we are going to see is first one is angle of mandible or Ghoniyan. Here you can see that. So Ghoniyan or angle of mandible. So between the ramus and the body of the mandible, that curvature, that deviation, that particular part is called as Ghoniyan or angle of mandible. They may mark this particular area and ask you to find out the structures attached to that. Structures attached to that. So the ligaments which is attaching to that, you have to write. Okay, and next one is lateral surface or external surface of ramus of mandible. They may dark this or mark this area and ask you to identify the marked area and mention the muscle which is attached to this particular area. That is how they may ask in the examination. Okay, that is about the skull. Next one is the lateral aspect. They may turn the skull laterally and they may mark this particular area. Let me show you that. Yes. So here, this is how they may mark it, and they may ask you to identify what is the marked area and name the bones which are fusing at that. Okay, name the bones which are fusing at that particular area. So this is called as Asterion. And also another question they may ask you is what is the clinical importance of this Asterion? Clinical importance of this Asterion, and which blood vessel is present exactly inside the cranial cavity at the level of Asterion? They may ask you. Okay, so you have to find out the names of all the four bones which are meeting over here. Asterion. Okay. Yes, moving to the next question is Asterion. Where is Asterion? Yes, here you can identify. To see the Asterion, to find out the Asterion, they mark this skull laterally. Anteriorly, we have seen the Asterion, exactly posteriorly, just above the Mastoid Process, and posterior to the Zygomatic Arch, where they may mark this particular area and ask you to identify this area. Okay, this is called as Asterion. Okay, so what is the clinical importance they may ask, and what are the structures present at the level of Asterion inside the cranial cavity? At the level of Asterion, which structures are present inside the cranial cavity, they may ask. Next one is Zygomatic Arch. Zygomatic Arch. Okay, this particular area they may mark and ask you to identify the particular area and what are the bones are fusing and forming this Zygomatic Arch, they may ask. Next question is Mastoid Process. Mastoid Process. What are the muscles attached to this Mastoid Process? Okay, so muscles attached and how it is formed, they may ask. If the examiner want to give you a tricky question, they may ask how the Mastoid Process is formed. Okay, one or two lines you may write about this Mastoid Process formation. So when the baby just below 2 years, when the baby starts rotates the head, that sternocleidomastoid muscle pulls the bony process, pulls the mastoid part of the temporal bone, and results in the formation of this mastoid process that you can write in the examination. Then styloid process. Styloid process, elongated bony projection, and ask you to find out this styloid process and what are the muscles attached or structures attached to this styloid process. You have to write stylohyoid, stylomandibular ligament, styloglossus, stylopharyngeus. If the question is asked two muscles, you have to write two muscle names. If the question has asked two ligaments, any ligaments, you have to write the ligament name. Okay, so that is about styloid process and mastoid process. Then we are going to see the maxillary tuberosity. This is called as maxillary tuberosity. And what are the muscle attached to this maxillary tuberosity? They may ask. Next one is lateral pterygoid plate. Lateral surface of lateral pterygoid plate. Okay, this is lateral pterygoid plate and it is a lateral surface of lateral pterygoid plate. They may mark and ask you to identify that particular area. And next one is anterior nasal spine. Anterior nasal spine. Okay, so the sharp bony projection which is present exactly below this nasal cavity, which is facing forward, that is called as anterior nasal spine. And behind the maxilla we can identify a small fissure. If you want to see that, if they want to ask you this particular question, they have to remove the zygomatic arch, or they have to tilt the skull and expose this pterygomaxillary fissure clearly. Okay, so pterygomaxillary fissure, where it is present exactly between the maxillary tuberosity and the pterygoid plate, so that comma shaped fissure, that it is called as pterygomaxillary fissure. And structures present in this pterygomaxillary fissure, they may ask. Next one is the superior part of the vault, superior part, upper part of the vault, where they may ask you to find out the bregma. So this bregma is a fusion of three bones, frontal bone anteriorly and posteriorly two parietal bones. That meeting point is called as bregma. Bregma, and posteriorly we can see the lambda. Okay, posteriorly you can see the lambda. Then the skull cap, after removal of the skull cap, inside that they may mark the particular area between outer margin or outer table and inner table of the skull bones. At the midpoint, middle area, they may mark and ask you to find out that. It's also a tricky question they may ask you. So that is called as deploy the bone marrow of the skull. Okay, then next one is inside the skull cap there is a small there is a groove which is present exactly at the midline. What is that groove? They may ask. They may mark this groove and ask you to identify that groove. So there is a groove for superior sagittal sinus. Groove for superior sagittal sinus. Okay, so superior sagittal sinus is a venous sinus, which is an unpaired venous sinus, unpaired dural venous sinus, that you can write. Then from anterior view, so far we have discussed about lateral view and we have discussed inside the skull cap, and now we are going to see from anterior aspect, norma frontalis, what are the questions usually they ask from the skull. So first one is supraorbital notch or foramen. Just above the orbital cavity, if you find out any notch, that notch is called, they may ask, that notch is called as supraorbital notch. If foramen is present, they may pass any needle in it and ask you to find out that foramen. That foramen is supraorbital foramen. Okay, sometimes in some skulls you can identify the notch, and some skulls you can identify the foramen. So if the notch is present, you have to write it as supraorbital notch. If the foramen is present, you have to write it as supraorbital foramen. Okay, the next one is the infraorbital foramen. Just below the orbital cavity, we can identify infraorbital foramen. What are the structures passing through, they may ask. Even for the supraorbital foramen or the notch, what are the structures passing through that? That is the second question usually they ask. Then the nasal bones, medial to this orbital cavity, small bones which are present here over the nasal cavity, that is called as nasal bones, right and left nasal bones. Yes, next thing we are going to see the orbit. In the orbital cavity, what are the questions usually they ask for the spotters? Orbit is very important, and it is also a bit complicated. So you need to be very careful, and you must have a good eyesight, and you must have good observation skills. Okay, let us see that. So first thing is, most posterior-medially we can identify the foramen. That foramen they may ask. They may pass any probe into that and ask you to identify that. That it is called as optic canal. Then just below the optic canal, you can identify another fissure. That fissure is called a superior orbital fissure. Then below this, we can identify inferior orbital fissure. So three structures, remember: optic canal, what are the structures passing through? Optic nerve, and the vessels. Which vessel is passing through this optic canal, they may ask. Okay, then superior orbital fissure, it is a very 3 marks question usually they ask. 3 marks question in the theory examinations. Superior orbital fissure. Okay, so specifically they may ask. So name the structures passing through the lateral compartment, or they may ask you what are the structures passing through the intermediate compartment, and they may ask you to write down the second question, what are the structures passing through the medial compartment of superior orbital fissure, and regarding the inferior orbital fissure, what are the structures passing through this inferior orbital fissure, they may ask. Thank you, dear friends. Thanks for watching, and please don't forget to share and subscribe to my channel. And in the next class, we are going to discuss about some of the questions usually they ask from the skull and from the mandible. Thank you, dear friends. See you soon with a new class.